thank you everyone so much for coming and giving me the chance to talk about my new book, which, as you can see, is titled Nonprofit Organizations and Co-Production. So the background of this research is I was really interested because co-production has become such a huge concept in the public administration literature. So this idea that by involving citizens in public service delivery, we can improve these public services. We also at the same time know that the third sector has become a really important provider of services. But we lack international comparative studies in this area. So there's questions around, is co-production easier or better in one context or another? Are there different opportunities or barriers? So the question that I address in this book then is, how can we understand whether, how, and why co-production between nonprofit professionals and citizens varies in different contexts? So you'll see from this, I look at three different contexts. So I look at England, France, and Quebec, and focus on one city in each of the contexts, and look at primarily services in the community development sector, kind of broadly conceived. So I looked at organizations that provide kind of low-level public health interventions, social services, leisure, mental health support, and you'll see also in France and England two programs that focus on older people's isolation and loneliness, and parent and toddler groups. Now, you may be thinking it's a little weird that I have two countries and then one province of Canada. So Quebec is, as I said, a province of Canada, but due to the federal structure of Canada, the responsibility for health, education, and social services has been devolved down to the provincial level. So really, it's a similar kind of unit of analysis. Quebec in particular has a huge amount of responsibilities because of a long and quite complicated history in terms of the different linguistic and cultural identity of Quebec. A lot more responsibilities have been devolved to the provincial level. So these are the areas that I look at. The study started by comparing England and France, and then I brought in Quebec as the third context, which I sort of expected to be somewhere between the two because of these, the mix of English and French. But ultimately, it turned out to be quite different. So I will get back into the kind of details of what I found. So to jump into the study, I have to first explain what I mean when I talk about co-production. This is one of these very contentious terms that's used to describe a lot of different activities. So I tend to use this definition by Bovaird of the provision of services through regular long-term relationships between professionalized service providers in any sector and service users or other members of the community. Now, one of the things is when we start talking about nonprofit organizations and co-production, this gets a little bit blurry. So this becomes a little bit less clear what we're talking about. So on the one hand, we could see nonprofits as this second stakeholder group, or the kind of other members of the community. So in this conception, we're looking at voluntary organizations, so kind of associations of citizens who then are co-producing public services with the government. Now, this contrasts then to a second conception where we look at the professionalized service providers in any sector. So here, we have nonprofit organizations that are professional organizations that have paid staff. And what we're looking at in terms of co-production is how it is that they involve service users and residents in the services that they provide. So these are both, there's kind of a different way that you can think about co-production. In this book, I focus on the latter definition. So seeing nonprofits as professionalized service providers, and how is it that they involve residents and service users in the services that they provide. So I think that's an important point to clarify, because this can, as I said, the waters get a little bit muddied when we're talking about nonprofits and co-production. So I'm going to jump in then to some of the key themes and examples that I found from each of the cases. And it's obviously very difficult to kind of distill 200 pages and years of research into a few minutes, but I wanted to kind of draw out some of the things that I thought were the most important or kind of telling for each of the cases. So in Sheffield, one of the first key themes or areas of co-production were activities that were co-facilitated by paid staff members and citizens or service users. So for example, one of the programs is a program of parent and toddler groups. And the way that they run it is that they train up parents as volunteers who co-facilitate these groups alongside early years practitioners. So here's where the kind of co-production is taking place. We also see a lot of community engagement kind of broadly defined. So this idea of working with communities, with kind of bringing communities into service provision in kind of a vague way. Another area is workshops, so co-design workshops. And one of the programs I looked at to tackle loneliness and isolation of older people did this a lot. So they would hold workshops for older people and kind of have an open question of, if you could have anything, what would be the thing that would, best support older people in your area? So really kind of led by the demands or the needs of the target population. Another really common example was really personalized approaches to providing services. So really focusing on individual needs and working one-on-one between professionals and service users. So really this kind of individual co-production. And alongside this, a lot of examples of peer mentorship approaches. So for instance, again, with the older people, they would have older people come in as volunteers and support other lonely, isolated older people in the community. But then on the more kind of negative end of the spectrum, there were a number of examples of what is sometimes called enforced citizen service provision. So a number of public libraries were being threatened with closure in Sheffield, and rather than lose this asset in the community, several of the nonprofits took over and started running the libraries, but only through volunteer efforts. So this is kind of a mixed area. It's not really co-production per se, because it's primarily delivered by volunteers and there's less professional involvement, but I think it was kind of an important area here. But really across these areas, one of the key themes that kept coming up was the importance of funding. So cuts to public services are widespread, and a lot of organizations are funded by contracts that often have very restrictive guidelines and expectations. So this was seen as a real barrier to co-production. And I'll get back to this later on in the presentation. So moving over to Lyon, one of the first very important themes was the importance of laws and charters. And this was something that wasn't really, we didn't see it all in the English case. So all of the organizations really like to codify all of their values, their missions, their beliefs, to the extent, for instance, the social centers, which are essentially community development organizations. The way that they're defined is a center for initiatives brought by associated residents, supported by professionals who are able to define and implement a social development project for the population of a local area. So what we see is that even in the kind of definition, the kind of codified definition of what these organizations are, co-production is written in. So it says, this is by residents, supported by professionals. And this is something that I also saw with the parent cooperative, which the abbreviation is essentially association of collectives of children, parents, and professionals. So it's really written into what the organization is. So this involvement means a lot of different things, this kind of collaboration. So it can mean, in part, contributing to the running of nurseries in the case of the childcare cooperatives. meaning involving parents in cleaning the nurseries, in the day-to-day running, in governance and decision-making, but also new opportunities to propose activities or services that the organization then supports to develop. Another really important area for involvement was in governance. So these organizations see this as where citizens and service users really contribute to co-production, is really in being involved in the annual general meeting, being elected to the board of trustees. This was a really key area. And finally, the organizations in Lyon put a lot of emphasis on the co-construction of strategic plans. So they've involved citizens and residents in the strategic planning of the organization. So they saw this as a really key area for them. So moving quickly then to Montreal, I think the first thing that's really important to know about Montreal when it comes to the nonprofit sector is that there's not just one nonprofit sector. We actually have kind of three different sectors of the nonprofit sector. So you first have nonprofits that don't engage in advocacy and they just deliver health and social services. There's social economy organizations, which are nonprofits and cooperatives that use trading to create social benefit and to create jobs in the local area. And then the third group is autonomous community organizations. So these are organizations that are recognized as being formed by and rooted in their community, that are free to determine their own mission and their own goals, and to pursue a mission of social development. But crucially, they reject participation in the market. So they say, no, we are not going to sell goods and services. We are not going to take on contracts for services. We demand that the government provides core funding for our activities. So this is this really strange situation. These organizations came about through lobbying and consultation work between the Quebec government, community organizations, and social movements in the 1990s, where the Quebec government agreed to develop a policy that protects the autonomy of these organizations and also guarantees their core funding. So they have this unusual situation. So then when it comes to the actual co-production approaches, these organizations undertake a lot of really like bottom-up co-creation. So in one of the neighborhoods, they have a wide large approach to consultation across the neighborhood, where they develop priorities for the neighborhood. And then through these priorities, they develop specific community actions and form groups to develop these. So these community action groups are required to be formed of, I think, 3 or 4 unaffiliated citizens and at least 3 or 4 paid staff members of local community organizations. So it's required, essentially, that co-creation, from the very bottom up, from the beginning of developing these services through to their implementation, requires the involvement of both stakeholder groups. And another really important area is that none of these things are done without networks and partnerships. So there's a huge amount of interaction between different community organizations, and the provincial government and the health authorities. And basically any meeting that I ever went to, there was somebody from 10 different organizations always taking part in developing services and in delivering services as well. So then the question is, I've run through very, very quickly kind of these main themes. So how do we understand? There's clearly something different going on between these 3 contexts. What does this mean? What can we do with this? And in the book, I develop a framework using the institutional logics approach as a way to better understand these differences between the 3 contexts. So institutional logics refers to rules, norms of behavior, and beliefs that structure decision-making within an organization. And these come from these 7 main institutional orders of society, these ways that organizations are shaped by these different elements of society. And when it comes to nonprofits, we typically think of them as being hybrids of the state, the community, and the market. This is kind of how nonprofits are typically portrayed in the literature, as being influenced by the values of democratic participation and bureaucracy and redistribution from the state, of neighborliness, reciprocity, etc., of the community, and increasingly this role of the market, such as a focus on profit and efficiency. So we think of this as being where nonprofits fit, is somewhere in between these. And then the way then that I kind of operationalize this so that we can really dig into, okay, so what does this actually mean in the real day-to-day world of nonprofits, is by breaking this up into rules, practices, and values. So rules are fairly easy to identify. These are the formal regulations, the constraints, things that are recorded and written down. We kind of know what these are. When we talk about values, that's the more sort of ideational and symbolic, the beliefs, ideas, and identities, so how things are described and understood by actors. And I see these as being connected then with practices, so these informal day-to-day activities, or the way things are done around here. So the way we can think about this is that we see some degree of influence of the state, the community, and the market on these rules, practices, and values. But it plays out very differently in the three contexts, and that we can see how these co-production practices are shaped as a result. So in England, what I saw then was the rules are primarily from contracts and funding. So this was the big thing that people talked about. Often these rules come into conflict with practices. So for instance, a contract that says you have to support vulnerable families and get them back on track within 6 weeks. That really conflicts with practices that are more family-oriented, or want to be more collaborative and co-productive with the service users. It's difficult to do that within that kind of time scale. So there are some tensions between those. The values that people talked about were around social enterprise, around community development, or this broad community engagement ethos. So sort of like working with the community, or trying to, use the products and services to support the local community. And then what this translated into in terms of practices were these pragmatic and informal approaches to co-productions. It was often very led by trying to improve things. We were trying to kind of use co-production to improve things. So I call this a service delivery logic. And what this is really a kind of assimilation of the state, the community, and market in ways that kind of fit with what we expect. There may be some tensions between these three logics, but ultimately that's kind of where the nonprofit sits. In France, things are different, as I've already kind of explained a bit. On the one hand, so we see rules that are strongly influenced by government, but also government policy and laws, but also formal internal participatory democracy. Values, really about a translation of the values of the French Republic into a local context. So there's not as much of a difference between the local community and the French state. And then this resulted in practices that were much more formalized, so more about strategic planning, participative democracy. And the way I describe this is as a social solidarity logic. So here we see almost a complete absence of the market logic. I didn't hear anyone talking about kind of efficiency or performance management. This wasn't something that seemed to be important. And so we really see a blend between the kind of Napoleonic state, this real hierarchical administration, and a local solidarity logic. These kind of fit together in a way that there's not as much of a sort of tension between them as we might see in other contexts. And finally, in Quebec, so the rules, as I mentioned, were about, we have guaranteed core funding and independence from the state. So there's guaranteed autonomy. The values are really around community solidarity and co-creation and citizenship. And then this leads to these co-creation action groups, these networks and partnerships formed of multiple different stakeholders, and a real emphasis on citizen activism as well that was a little bit absent in the other contexts. So I call this a social movement logic, and I say this tentatively just because these aren't social movement organizations. They're not organizing, protests, etc. But there's a real, you can see how this kind of idea of operating forms their approach to service delivery. So again, we see a complete rejection of the market logic. We see a kind of uncomfortable kind of distancing from the state logic. And essentially the community logic is really what purely drives these organizations. So if I had to sum up the entire book, I think in one table, I think this is probably how I would do it. What we see then is through these three different logics that really guide the organizations in the three contexts, different types of co-production are prevalent under each. So I think this is something that we haven't really seen before, like kind of looking at these different approaches to co-production that are really linked to different value and conceptual basis. So the service delivery logic is really pragmatic. It's really individualized. They don't see as much of a sort of tension between seeing people as customers and service users. And it's a bit more ad hoc. So it's not as mainstreamed as in other contexts. It's really about, we're trying to just make things better. Involving people is going to make things better. So the social solidarity logic, much more formalized. We have much more of an emphasis on participatory democracy. So this results in much more collective co-production and involvement in governance and strategy. So then finally, with the social movement logic, I think this is much more citizen-led co-production. It's much more bottom-up. So it's still co-production. We still have professionals and citizens or residents working together, but it's the citizens that are driving the agenda. It's really based more on collective action rather than starting with the service and bringing citizens in to kind of to change things. So with that, thank you so much for listening, and I look forward to some questions and discussion.